So I'm going to talk to you today a bit about bladder pain syndrome. So bladder pain syndrome is a fairly uncommon condition that affects around about 5% of the population. So that means roughly about 5 per 100 people. And what that means is that not very many people have heard about it, and certainly not very many medical people truly understand how to diagnose it, what the symptoms are, and actually how to treat it. And on top of that, that means it can be quite isolating, because if you suffer from symptoms of bladder pain syndrome, it can be difficult to know exactly what way to turn to try and get help and support in managing the condition and living your life. So bladder pain syndrome is in essence any painful condition affecting the bladder or part of the urological system. It can also be related to any problems that people have with pelvic floor or any of the muscles, or indeed any of the nerves affecting the urinary system. Previously, people thought that it was a condition called interstitial cystitis, but now we really understand that that name doesn't actually hold very true. Interstitial cystitis implies that there is an inflammation of the bladder, cystitis being inflammation of the bladder. And actually very often people who have bladder pain syndrome don't actually have any inflammation of the bladder. So we tend not to use that term anymore. It's very much an outdated term, and we tend to go by the expression bladder pain syndrome. Certainly when I first started to study medicine, no one had ever really talked about it, or certainly wasn't understood, and I wasn't taught about it at medical school. I suppose it's really only since I've developed my interest in pelvic pain and abdominal pain conditions that I really began to understand what the condition entails and how much of an impact it can have on your life. So people who suffer from bladder pain syndrome often suffer from a constant irritating pain. It can be very generalised and it can be a dull ache. But at the same time, they often have associated similar urinary symptoms. And that can be the constant urge to go to the toilet, to pass water. It can have a feeling of burning when they're peeing, a feeling as if you're passing sharp bits of glass, and a general just irritation of the bladder or any part of the urological system. And so you kind of, in that respect, have two problems and two major issues to contend with in your life. In that not only do you have the problems of a chronic pain syndrome and all of the associated difficulties and tiredness and fatigue that entails, but you also have to contend with juggling the constant need to go to the toilet. And that can have a big psychological impact as well, because we all know that there's nothing worse than being out and about someplace or being on a long car journey and having that sensation or fear of panic that you need to go to the toilet and you need to go in a hurry, otherwise you'll have an accident. So actually, bladder pain syndrome is actually quite a debilitating condition that really needs properly managed. It can be managed in a number of ways, and probably is actually best managed by a very much a multidisciplinary input. And that's because the condition is not managed by one single tablet or treatment. It's important that you target the different aspects of the nervous system when treating bladder pain syndrome. So you can have nerve painkillers that can reduce the irritability of the nerves that supply the sensation to the bladder and the urological system. But it's also important at times to look at the pelvic floor, the muscles which supply and hold and support the bladder and associated structures, because very often the symptoms of pain are exacerbated by tightness of these muscles, or indeed weakness of the muscles as well. And sometimes actually it's important to have a bit of psychological support as well, because coming to terms with understanding the condition and then learning how to manage it is really the key to successfully learning to live with bladder pain syndrome, but actually managing it really well and living your life to the full.